Hi there. My name is Deborah Stevens, and I'm a CLL expert at the University of North Carolina. And I'm here to answer a few questions that were submitted on Ask the Expert about chronic lymphocytic leukemia. So the first question was, I have CLL, and I was curious if it would be safe for me to get a lymphatic massage. Thankfully, the short answer is generally yes. And I put up a picture of lymph nodes here so you can understand the extensive network of lymph nodes that are within the body. And the thing about this is that they're all connected already. And so a lot of people's concern about getting lymphatic massages is that they're spread the CLL. And in reality, if we did a biopsy of any one of these lymph nodes, we would find CLL. And so, it doesn't really spread just by being massaged. It really is a function of these lymph nodes are all connected anyway. And so it is safe, in terms of the risk of spreading CLL is something I wouldn't worry about. So generally, the answer is yes. A couple of things to consider. Of course, with deeper tissue massages, if your platelets are low, which are the cells that help your blood to clot, you do have a risk of bruising. Another, if you are taking a drug called a Bruton tyrosine kinase or a BTK inhibitor, these are drugs like acalabrutinib, ibrutinib, pirtobrutinib, or zanubrutinib, you might be at an increased risk of bruising as well with those, especially with those massages. But light massage, things like that should still be okay for you. And it's always useful if you have specific questions about something within your own medical history to check with your oncologist if you have any specific questions about your risks. But in general, I would say it is safe to get lymphatic massages. So moving on to the next question. This question was submitted and said, I am no longer under the care of a CLL specialist, and now I am cared for by a general oncologist taking venetoclax 200 milligrams daily. My lab results have been normal. Are there guidelines for dosing over time when labs are normal? So there are a couple of things to think about here. First of all, my question is, how long were you intended to take venetoclax? And the reason why I would ask this question back is because most often it is actually given for shorter periods of time, 1 to 2 years with a plan to discontinue. In the frontline setting, we usually give this in combination with a monoclonal antibody called obinutuzumab, and we give a 1-year duration and then have a treatment-free period. In the relapse setting, we give it with either rituximab or obinutuzumab, and there's usually a 2-year period of treatment, and then there's a treatment-free period. Or there are some people who are recommended to take continuous treatment until progression, and that may be the category that this particular individual is in. But I would just want to clarify that with your oncologist, because it's possible that this person could actually stop the venetoclax if that's appropriate. The other thing I wanted to point out is, why was the dose reduced? Of course, the typical dose of venetoclax is 400 milligrams daily. Of course, you all know that there are lots of reasons for lowering the dose, but just checking in that is the correct dose that they should be on. And, maybe a consideration is, this is a really good question, and it might take a check-in with a CLL specialist. And so, there are constant changes with new research. And it's possible that this patient no longer needs to be on the venetoclax. It sounds like good news that the lab results have been normal, meaning that the drug isn't causing any toxicity. Sounds like the CLL is under good control, but it may require some input about this patient's specific condition with a CLL specialist. So overall, really good question. The next question I want to touch on is, I'm being treated with zanubrutinib and developed side effects of cough and high blood pressure. My oncologist recommended stopping the medication, and once side effects resolved, I started on a lower dose. Is it recommended to take 2 pills together or take 1 in the morning and 1 at night? What else should I do to reduce the risk of side effects? So this is a good question. You may or may not know that once or twice daily dosing is allowed per the label for zanubrutinib. However, my preference, especially in the situation where the drug has been reduced, is to take it twice daily. This is a complicated graph, but I just wanted it to show it. It exemplifies. So this is the standard target dosing, which is 320 milligrams. The once daily dosing is in blue, and the twice daily dosing is in red. And what this indicates, this green line, is the level that you want the BTK to be inhibited above. And so, of course, in this particular graphic, both of those lines hit above. So if you're on the full dose of zanubrutinib, I think taking either once daily or twice daily is fine. But once you lower the dose, these curves are going to start out a little bit lower. And you can see, that once daily curve at the end of that 24-hour period is getting pretty close to that green line, where it indicates that below that, you might not be getting full inhibition of BTK. So I think, either one is fine. My preference would be for you to take whatever is best to remember. So if you can only remember to take it once daily, do that. However, I think there would be an advantage in the situation where the dose was reduced to take it twice daily. Sounds like this individual is doing the right things by reporting the side effects to their oncologist. The oncologist is listening to them, they're holding the dose, they're reducing it if appropriate. And so really those are the best things that you can do to reduce the risk of subsequent side effects. So reporting those to your doc, talking about them, making sure that they're making adjustments as needed. So last question, are some treatments better at clearing the bone marrow of the B cells than others? And I will say that I put a picture up here of apples and oranges because not all treatments for CLL are the same. So treatments work in different ways and at different speeds. When you think about BCL2 inhibitors like venetoclax or monoclonal antibodies like obinutuzumab or rituximab, they typically work more quickly. So you might see a quicker clearance of the cells from your bone marrow. The Bruton tyrosine kinase inhibitors or BTK inhibitors like acalabrutinib, ibrutinib, or zanubrutinib, they typically work more slowly. However, they're still very effective. And despite these difference in clearance speeds, they both are quite fast at reducing the symptoms related to CLL. And they're just different treatments. And so yes, there might be a difference at the speed or the amount of CLL that's cleared out quickly of the bone marrow. However, both of these treatments are working differently. They both work very effectively. There was actually a recent clinical trial presented called the CLL17 study that looked at either using the time-limited therapy with the BCL2 and CD20 antibodies versus continuous therapy with BTK inhibitor, and they both had very similar outcomes in terms of how long a person could stay on the drug without progression. And so basically, yes, there are some differences in the clearance, but all of these drug classes are really great. And so that is my final question, and I will go ahead and conclude my answers today.